Medicaid expansion can help Missouri combat the COVID-19 crisis. Medicaid expansion has never been more important than it is right now. In the midst of the global pandemic and a devastating economic downturn, Missourians need access to healthcare. Missouri has one of the most restrictive Medicaid programs in the country, leaving out most non-disabled, non-pregnant adults.
Medicaid expansion is critical for Missouri. We have the opportunity to expand our Medicaid program to cover hardworking but uninsured Missourians up to 138% of the poverty level. Medicaid expansion would help more than 219,000 uninsured working Missourians gain coverage through Medicaid. Right now, a lot of people don't know that Missouri has one of the lowest Medicaid eligibility levels in the nation. For a family of 3 to qualify for the parents to have health insurance through Medicaid, they can't make more than $400 a month. That's a really low income, and it means that a lot of people are shut out of health insurance. If you don't have a custodial child or a total and permanent disability or a couple of very small other exemptions, you can't qualify for Medicaid no matter how low your income is. So what we're finding is that there are a lot of people who fall in what we call the coverage gap in Missouri. People who are working, so their income puts them above the very low level where they could qualify for Medicaid, but they don't make enough money to qualify for discounted health insurance through the health insurance marketplace. A lot of these are people we all know, people who work at restaurants, who mow our lawn, who provide childcare, who take care of our parents. They're working hard, they're contributing to society, they're doing everything they can, but their employers don't provide health insurance and they aren't able to afford it on their own.
Medicaid expansion would change that by extending coverage to over 230,000 Missourians at a critical time. With the state's uninsured rate rising due to loss of job-based insurance during the COVID-19 crisis, many recently unemployed individuals have no good options for staying covered. Medicaid expansion is the lifeline they need. The state's economy would also benefit from over $1 billion in federal funds brought into the state during an economic downturn, ensuring compensation for our frontline health professionals.
Missouri chose not to expand. Missouri chose not to take the Obamacare funds that we lost to other states because of the word Obama was on the ACA, and they decided that they wasn't going to take it.
Missouri has a choice: expand now or combat the COVID-19 crisis with both hands tied. Missourians can make expansion a reality with the passage of Amendment 2 on August 4th, 2020. Why expansion now? To date, most states have expanded their Medicaid programs to cover low-income adults with incomes up to 138% of the federal poverty level. In those states, substantial evidence indicates that expansion reduced the number of uninsured people, improved access to care, increased access to substance use treatment and mental health services, and lowered overall state expenditures. Benefits that are even more crucial during the COVID-19 health and economic crisis.
There are almost 250,000 folks in Missouri right now who have no way to access health care whatsoever because of the eligibility requirements right now. And so expanding Medicaid would allow people to have a chance, just to have a chance to receive care. It would reduce costs. It would bring back our tax dollars to Missouri. Major corporations are on board, from the Hospital Association to religious affiliations. So it's something that the majority of Missourians back, and it needs to happen. It's very much past time for Missouri to expand Medicaid.
In Missouri, expansion will help keep our rural hospitals open, bring federal tax dollars to the state, and help hardworking Missourians and their families gain health coverage. What is the coverage gap? In Missouri, Medicaid is available only to adults with dependent children whose incomes are below 17% of the federal poverty level, about $300 per month for a family of 3. Non-disabled adults without dependent children are simply ineligible for Medicaid, regardless of their income. Medicaid expansion offers a pathway to affordable, high-quality healthcare for Missourians who would otherwise have no way to get their health insurance because they are stuck in the coverage gap. That gap includes people who don't get insurance through their jobs or don't earn enough to qualify for subsidized coverage on the health insurance marketplace, but have income too high to qualify for Medicaid.
So I make too much money for Medicaid, and I do not make enough money to be able to afford insurance on the exchange. So I'm stuck in the middle between these two places. And I'm afraid I'm going to die because I don't have a way to go get my heart checked out.
Most states have closed the coverage gap, but here in our state, as the COVID-19 crisis worsens, thousands more Missourians are falling into the coverage gap as they lose their jobs or have their hours reduced.
In Missouri right now, in order to qualify for the program, as a family of two, you can't make any more than $3,000 annually. So that leaves 250,000 Missourians with no access to health care. They're too rich for Medicaid at that ridiculously low threshold, but too poor for a marketplace plan. So they're stuck in the coverage gap. If their employer doesn't provide insurance for them, they have no way of accessing health care at all. So people are dying in our state.
How does COVID-19 exacerbate the coverage gap? Many Missourians are losing their jobs due to the current economic downturn and are therefore losing their health insurance. Without insurance, people are less likely to seek care when they first feel sick, which runs counter to what we need to keep our communities healthy during the COVID-19 crisis. An additional 119,000 Missourians who lost their job-based insurance will fall into the coverage gap by January 2021. Whether due to an unexpected job loss or a catastrophic event, every Missourian is one accident or illness away from being uninsured without Medicaid expansion.
I had insurance most of my life, up until the time I was 30. And when I was 30, I was in a motorcycle accident. And while I was out on medical leave, my job was bought out by another leading competitor. I was a 777's Auto Workers Union at the time. When I came back to work, I was let go because I didn't have any union protection at that point, which left me covering insurance for approximately $900 a month. But at being out of work for 4 months already, I was already through my savings. So the last 10 years of my life, I've not had insurance due to cost.
I look like I'm healthy. I look like I've got all this great stuff going for me, and there's truth to that. I do. But if anything accidental happens, I've got nothing, and I'm screwed, I guess. There's nothing I can do about it.
Expansion is one of the best tools a state has to ensure continuity of coverage during volatile times. How does expansion improve health? Medicaid expansion improves health outcomes. These improvements have been documented in other states, including the neighboring or nearby states of Arkansas, Kentucky, and Louisiana. Benefits include increased use of primary care, increased access to substance use treatment and mental health services, increased filling of prescriptions for chronic diseases, and decreased mortality, to name a few. In contrast, without expansion, upstream use of primary care is postponed in favor of downstream use of more expensive emergency department or inpatient care after health conditions worsen.
I don't know what it's like to have a primary physician. I don't know what it's like to go to an emergency room. If it wasn't for Planned Parenthood, I would never see a regular doctor. If I had access to normal health care, a primary physician, an allergist, I also suffer from really bad seasonal allergies and debilitating asthma, I think I would live with considerably less fear.
Without Medicaid expansion, we see deaths of people who might survive if they had health insurance.
The truth is right now, Missourians are dying because they don't have health insurance. They're dying from cancer diagnoses or treatment that they have to delay. They're dying because of ill-treated diabetes because they can't get regular care or their medications. They're suffering throughout the state, and they're dying premature deaths because they aren't able to access the health care they need.
For example, they delay screenings that lead to early-stage cancer diagnoses and treatment, or simply aren't getting the treatment for a drug problem or depression. And without expansion, individuals lack the security of knowing their basic health needs will be covered.
About 4 years ago, I had open heart surgery and I've had an aortic dissection and an aortic abdominal aneurysm, and my aortic heart valve has been replaced with a pig valve. And I didn't have money to afford any of this. And unfortunately, I was off work and missed a lot of time off work because of this. And I could have seen it coming with simple tests, but I didn't have insurance, so I didn't get those tests done. And even now, 4 years later, I'm sitting here with this heart pig valve in my heart, and I can't afford to go get a CT scan to see if it's working or if the dissection's going to come back. I don't know. Every day I don't know what's going to happen. I don't know how it's going to go. It's a struggle. There's a lot of anxiety there, a lot of fear. Every night when I lay my head down and go to sleep, I wonder, am I going to wake up in the morning? I don't even know. So it's hard to sleep. It takes a toll on your body.
Furthermore, Medicaid expansion is a good budget deal for Missouri. Medicaid expansion brings federal funds into the state for 90% of the cost of services that would otherwise have been covered completely by the state or absorbed by providers through uncompensated care. In fact, research shows that the small nominal cost for states to expand Medicaid was offset by savings from reduced spending on state programs such as those for the uninsured or for behavioral health services. What are the economic implications of expansion? Medicaid expansion is an effective way to jumpstart Missouri's economy. In the first year of Medicaid expansion, participating states saw job growth at 2.4%, while non-expansion states saw 1.8% job growth. Medicaid expansion is particularly important for rural hospitals during the COVID-19 pandemic. Being in a Medicaid expansion state decreases the likelihood of a rural hospital closing by 62%. The potential financial protections for Missourians are also critical. A trip to the emergency room would no longer put Missourians at risk of bankruptcy.
I think we need to expand Medicaid in Missouri. I think we should have done it 10 years ago. I didn't have health insurance during most of that time, so I was a working adult that was in that gap. So it was really frustrating to know that other states fixed this problem for folks like myself and my family. Missouri didn't, largely for political reasons. As a working adult, it's kind of frustrating because you do what you're supposed to do and you have a job, or plenty of people have 2 jobs even, and none of those jobs offer health insurance. And especially in Missouri, you fall in that gap, and it's you can't go see the doctor on a regular basis, which of course leads to things building and building until it's an emergency situation, and then you're bankrupt. So again, I'm not alone. I know there's lots of people in our state that have ended up suffering financial consequences, and it's stressful. You're worried all the time.
And coverage means people seek necessary care that keeps the community healthy, like COVID-19 testing and treatment. Medicaid expansion has established itself as a cost-effective coverage option for many states, especially during the current economic downturn. As the COVID-19 crisis worsens, it will only become more important for Missouri to join the 37 other states with Medicaid expansion. Missourians can make expansion a reality with the passage of Amendment 2 on August 4, 2020.
Missouri has the opportunity to expand Medicaid and cover more than 219,000 uninsured working Missourians, and it's a great economic deal for our state. Nobody's taxes go up, it's already paid for. We'll bring back millions of Missourians' tax dollars from Washington, D.C. to spend right here on the state, creating good jobs with benefits and stimulating our local economies while we take care of Missourians.